Hi, it's Dr. Noel Williams, Optimal Health Associates, COVID update, the 22nd of December 2021. So I just got off an hour and 20-minute Oklahoma Task Force meeting with Deputy Health Commissioner Keith Reed, who was fantastic. Congresswoman Stephanie Bice joined us, who was also absolutely fantastic and took a lot of notes, and I have a follow-up phone call with her afterwards. Big thank you to all the CMOs, Aaron Boyd from Norman, Kirsty Winfrey from Saints, Cameron Manter from OU, Carl Roskowski and Julie Watson from Integris, Chad Smith from Mercy, and I'm sure I'm missing several others, but they all had a lot of input today. A lot of people from the state on, Dr. Pai, the state epidemiologist or infectious disease expert. So this is where we are in the state. We're up, we've had a doubling in our hospitalization rate in 4 weeks. We're at about 700 hospitalizations. Our COVID positive rate, in terms of we're having more and more positive COVIDs, is going up, and it's hard for the state to track because so many people are doing home tests. So looks like Delta's here, Omicron is here, and the case volume seems to be skyrocketing. The problem we're having, is all the hospital CMOs said, is there's no nurses, and I'm not sure if it's one system alone has 200 beds, but we're at least 200 hospital beds down in the Oklahoma City metro due to staffing. And there's no solution for it. There's no nurses, there's nothing. So there's a big delay on just, if you have a heart attack, you get stuck in a hallway, you have things that you need to get done that's not COVID, there's gonna be challenges in the coming weeks. So it's a pretty abysmal situation to be dealing with. It's a little bit disappointing, but it is what it is. So what can we do? I think the first thing is vaccination for those people who have not been vaccinated or infected. I think that is going to be our number one thing. For those of you who are thinking that there's going to be outpatient therapy for you, unfortunately, that was all bad news. Too, when Pfizer gets released, the Pfizer drug, there is not that many of the dose packs made. We are going to get 680 of them for the state, and we're going to get an allotment every 2 weeks. We're having well over 1,000 positive tests a day, maybe 2,000 positive tests a day. Fauci is Fauci, but sometimes he does have statistical things that could be probable or possible. And we're estimating that the Omicron infection rate could go to several 100,000 a day in the United States, perhaps even higher. And the problem with that is if you're vaccinated and you get it, your chances of getting really ill is limited. If you've been infected, it's probably pretty limited. But if you haven't been vaccinated or infected, if that many of other people get it, and some of them are going to get sick, it's just, even though it may be not as intense, it's still going to make some people sick. And and the hospital systems across the country are busted. So we're not going to have any of the Pfizer drug really readily available for months and months and months. And then eventually that's going to be really helpful. The Merck drug is kind of still in this final approval process. And again, we have no idea about access to it. It's not nearly as effective as the Pfizer in the clinical trials, so that's a bummer. For those of you who have thought about ivermectin at times, there's no ivermectin around. If a doctor wants to prescribe ivermectin, not that I'm endorsing that or criticizing that, you can't get it anywhere. So that's out. So again, there's not a lot of prophylaxis out there or early outpatient treatment besides antibiotics and steroids. So again, prevention is key. If you're not vaccinated, get vaccinated. I'm not even going to spend time on boosters because I think there's a huge debate about whether they're important or not. The World Health Organization came out and said that boosters are going to prolong the epidemic or pandemic. I think that we should be vaccinating the rest of the world. That's a better use, but there's no money in it for the big drug companies, so that's why, boosting the United States makes sense versus giving all those doses to Africa where Omicron came from, and South America, and then the Middle East. But that's what I would do. I think we got to get everybody vaccinated at least once. So anyway, that's where we are. So Christmas is coming. Last year after Christmas, our office had on New Year's Day or New Year's Eve, we had 38 positive COVID patients that we treated. We don't have anywhere near the ability to offer the same treatments as we did last year. So just keep that in mind. So there's a lot less ability for us to help you right now. And then thinking, well, there's antibodies. No, the antibody allotment too from the federal government has been cut way back to the state and throughout the United States. Congresswoman Bice is going to be working on some of that for us and see if she can impact either the Pfizer med or the antibody stuff. But again, it seems like there's just problems with the supply chain or how they're going to give it or the thinking about how to give it from the federal government level. So we're going to be kind of on our own for the next several weeks. And we really need to focus on, if you get COVID, you need to isolate. Don't infect other people. Stay away from people who have COVID. Don't go by them, even if you're vaccinated right now, either because there's no redundancy to the system. Third, take your vitamins. You need to be on your zinc at least a couple times a week, your multi, your vitamin C, your fish oil. Call your primary care if you get infected. Get some information on what you can do. That's the big message tonight. I wish it was more positive, but we're at that tipping point right now where the healthcare system is exhausted. Supply chain for the therapeutics that I've used and the new ones I'd like to use is not available. The hospital supply chain for the things they need is not available, both for staff and for medicines. So it's kind of frustrating. And I guess, we'll do a post hoc analysis at some point of why a year after this all happened and Delta was going on, there's not been any improvement with supply chain or any of it, and why we still don't really have an outpatient treatment algorithm in place, which the NIH and CDC and FDA should have put in place. But anyway, that's where we are. Take your vitamins, stay positive, and Merry Christmas. You're in my thoughts. Bye.